guys, I hope you guys are doing well. In this video I'm doing a 30-week pregnancy update. So today I am 30 weeks and 3 days, meaning I am in week 31. I passed week 30, now we're into week 31 technically. So these symptoms I feel like are more, not necessarily just this week, but from last week as well. I'm gonna look at my computer. I jotted down some things. So one thing is fatigue is back. I've definitely been more tired. I've wanted to sleep more, and I feel like maybe I don't get enough sleep at night, because if I'm not feeling well, usually if I take a nap, like a 2-hour nap, I feel amazing and rejuvenated. So fatigue has returned. Some other things that I've had is definitely like anxiety, depression, and insecurity. I don't think that people really talk about the emotional side of pregnancy enough, because pregnancy does affect you on an emotional level. So like anxiety, I've had pretty high anxiety lately. Not super high, but I don't know, I can't even like explain it. I guess an example would be like if I'm reading something and I'm reading like stories of, or like birthing stories or labor and delivery stories, I get anxiety. I get like stressed. I'm like, So when I'm on TikTok and I see posts that talk about different things, facts about pregnancy and labor, and then I look in the comment section, I'm like, oh my god, what? Each semester comes with its new things, like you learn different things. And going into the 3rd trimester, you learn about labor and delivery, and on the internet there are a lot of horrifying stories, not of like, not like the stories of women almost dying, not like that. It's more like horror stories of women giving birth in hospitals, not being listened to, not knowing their rights, and stuff like that is what stresses me out, because I am ignorant when it comes to labor and delivery. I have no idea what to expect. I have no idea what my rights are. It just stresses me out. So I've had anxiety about that. The depression, I've been more sensitive, wanting to cry. I've had complete lack of goals. Not complete lack of goals. I've been working on like being more clean and organized, because before I was not clean and organized, and that was stressing me out, and that was giving me anxiety in the 2nd trimester. So at the end of the 2nd trimester going into this trimester, I've gotten way better at cleaning, so that's a good thing. But when I say lack of goals, I mean like more like what I'm doing with my life. Like I have no idea. I have no idea. If you would have asked me 2-3 months ago, I could have given a straightforward answer, told you all the things I want in life, but now I'm like blank. Mind is blank. And it's not because I'm having a baby that is. I think it's just, I don't know, I'm just having a hard time. I don't know, I just don't want to think about it. Like it's the last thing I want to think about, to be honest. It's like my goals in life and what I want to do. Maybe I should just start writing or something. Maybe that'll help me. I don't know. But that's been, I put that in the category of depression, because usually that's what happens when you're depressed. You stop liking the same things that you used to like. So I literally like did my hair, did my makeup to try to feel like myself again. And I'm filming to try to feel like myself again. I miss making videos like this. But yeah, that's where the depression is. It's not, I don't think it's severe. It can be if I'm not, like, was it yesterday or I think it was the day before. I didn't take my prenatals, so super out of whack, because I didn't have it. I left it at work, and no, that wasn't, it's not a good idea. That day my depression, I feel like, was severe. I just wanted to lay in bed all day. So depression has been one. Nausea has come back. It's made a return, sadly, and it just sucks. It's not not as bad as the first trimester. The first trimester, the nausea was more because of the hormones. Now it's because of the size of my baby, now that I'm having nausea. It could also be a reason as to why I have a lack of appetite. I've had a lack of appetite. That could also just go into the depression and anxiety though. So I've also had a lack of appetite. And yeah, that's pretty much all the symptoms. I went through them kind of fast. But yeah, I said like the nausea, it's really mainly because he's growing. So in the first trimester, you experience that stuff because of just the hormones. It has really nothing to do with the size of the baby, because they're not big enough to really be pushing on your organs and stuff. Now he is. It's not terrible. Like, it's definitely nothing compared to the first trimester. But if I eat too much at once, then I will be pretty nauseous. And oh, I did put insecurity on the list, which ties into depression and anxiety. But I've been like looking at old pictures of myself, old videos of myself, and I'm like, oh my god, like I never thought I would miss having a flat stomach. I feel very selfish saying that, being pregnant right now, but looking at my body before, I was like, because I've taken nude pictures of myself like before even me and my boyfriend started dating. Like, I would just take them because I was trying to feel cute about myself, and I saved them on my phone, which I highly recommend. Just take nude photos of yourself so then you can look back and be sad about them. No, I'm kidding. But I do look back and I'm like, oh my god, like I was skinny. Like, I was pretty skinny, but like my body looked really good, and I think that I can for sure get back to that. But being pregnant, you really do have to be patient with yourself and accept the fact that your body is just gonna change, and also it's temporary. Of course it's gonna change. It's probably not gonna look the same as before, but it is temporary, you know. For instance, my mom told me she never had like the like saggy skin afterwards. She didn't get stretch marks on her stomach when she was pregnant. I think those things are definitely hereditary, because a lot of people, the internet shows you all that stuff and the saggy stomachs and stuff, but a lot of people actually don't, their bodies actually don't look like that after pregnancy. I mean, I'm sure a lot of women do, but there are a lot that don't. Like, I don't think I've actually seen any pregnant woman's stomach that's looked like that, like from people that I personally know who have given birth. So, you know, I just gotta accept that it's temporary. The weight gain is temporary. The number on the scale doesn't scare me at all. I've never really been a person that gets stressed over that. It's just normal. It is what it is. Like, and it's not just the baby even. It's not just the baby's weight. It's the amniotic fluid. It's, I don't know, other stuff going on in there. But my camera's dying. I'll show you guys my bump. Hopefully my camera doesn't die. So this is what my stomach looks like. The doctor says it's the perfect size every time I go in. And yes, that line is there. My mom was like, that line's never gonna go anywhere. I was like, whatever. I actually like the line. I think it looks cool. My mom was like, you need to shave that hair. And I was like, I shaved it and I hated the way it looked. I don't know. I think it adds some character to my stomach. I don't know. It looked like I had a fake pregnancy belly on. It was really weird. But I hope you guys enjoyed this video. A little update. Didn't want to make it long. I wanted to make it at least 10 minutes, but my camera's gonna die any second now. But let me know what week you're at, how your third trimester is going, what your due date is, what you're excited about, what you're nervous about. There's just so many things. Like, I still don't know if I'm gonna take one of those classes or not. That stresses me out. There's lots of things that stress me out that I don't want to think about. But yeah, hope you guys have a nice day, and I will see you guys in my next video. Bye.